Good morning, everyone. Welcome to Ontario Shores Centre for Mental Health Sciences. My name is Karim Mamdani. I'm the President and CEO here at Ontario Shores, and it's an absolute pleasure to welcome all of you here today. I'd like to acknowledge the lands and the people of the Mississaugas of Scugog Island Nation, which are covered under the Williams Treaties. We are situated on the traditional territory of the Mississaugas, a branch of the Greater Anishinaabe Nation, which includes Algonquin, Ojibwe, Odawa, and Potawatomi. I'd like to welcome the Honourable Sylvia Jones, Deputy Premier and Minister of Health, as well as the Honourable Michael Tibollo, Associate Minister of Mental Health and Addictions, to Ontario Shores. We are also pleased to welcome the mayors of Whitby, Liz Roy, and Uxbridge, David Barton, as well as MPP Patrice Burns and MPP Parliamentary Assistant to the Premier, Lorne Coe, whom I will introduce shortly. We are just one of the many important components of the system for mental health and addictions, which is made up of many different types of community service providers like hospitals and mental health associations. At Ontario Shores, we are all very passionate about working together with providers from all over the healthcare system to make sure that Ontarians have access to the full life-saving mental health care that they need to live full, meaningful lives. We're excited about new opportunities to share our knowledge and expertise in order to advance the mental health and addiction system and meet rising demands. It gives me great pleasure to welcome to the podium a longtime friend, advocate, and champion of the specialized care we provide to our communities, MPP and Parliamentary Assistant to the Premier, Lorne Coe.
Thank you. Well, thank you, Karim, for that kind introduction, and good morning, everyone. When we released our first plan to stay open in March of 2022, we made a promise to build an Ontario that is ready for the challenges of tomorrow. We have dramatically expanded Ontario's health workforce with more doctors, nurses, and personal support workers. We've added thousands of hospital beds, with the most significant expansion of long-term care beds well underway. We're also investing in building new hospitals. With Minister Jones's leadership and vision, the government continues to take action to transform mental health care in our province, ensuring that patients of all ages can access the care they need when they need it, no matter where they live, including Whitby and other parts of the region of Durham. That is why I'm so pleased to be able to welcome my esteemed colleague to Ontario Shores Centre for Mental Health Sciences Centre, one of the 4 provincially specialized mental health hospitals in Ontario, for this morning's announcement. Ladies and gentlemen, please join me in welcoming the Honourable Sylvia Jones, Deputy Premier and Minister of Health, to the podium. Welcome to Whitby, Minister Jones. Thank you.
Thanks so much. You know, I want to echo what Karim said. Lorne has been such a strong advocate and supporter for Ontario Shores, so it's a real pleasure to be able to join you here again. So good morning, everyone, and thank you all for joining us here today. I want to thank Karim and your entire team for your warm welcome to Ontario Shores once again, and for the incredible work you do each day to provide care to our most vulnerable. On behalf of Premier Ford and our government, I want to say thank you. I also want to acknowledge our colleague Patrice Barnes for joining us today. You know, Patrice, as a new MPP, has been such a strong advocate for the Durham region, so thank you, Patrice. The people of Durham region are in great hands with my colleagues Lorne and Patrice at Queen's Park. Today, mental health is at the forefront of many conversations, And one of the most important things we can do today is taking the time to listen to the stories of people living with mental illness and learning how we can support them in a more meaningful way. We also know that our children and youth face challenges that are unique to their generation, especially given the past 2 years. We owe it to them to ensure they can continue to connect to care closer to home. That is why we are implementing innovative programs and services that are easy to access, including by phone or online. Today, I am pleased to announce that our government is investing an additional $4.75 million to expand the One Stop Talk virtual walk-in counselling program. This investment will provide more children, youth, and their families timely and convenient access to mental health counselling no matter where they live. One Stop Talk was launched with 6 organizations just last November, and it has already served nearly 1,000 patients. That is tremendous reach for only 3 months of operation, and that is why we want to expand this service to reach even more children and youth across Ontario, because our government believes in the importance of being able to connect to care closer to home. This convenient service will help youth connect to care in both English and French through telephone, video conferences, texts, and chat options without an appointment. Our government has a plan to build a stronger, more convenient and connected healthcare system by investing in our hospitals and healthcare facilities across Ontario, by investing in the mental health services that Ontarians of all ages need, so that patients can connect to the high-quality care they expect whenever and wherever they need it. Because we know the status quo is not enough. We need to be bold. We need to be creative. We need to be innovative. Ontarians are counting on us to improve health care for generations to come. These bold solutions will still mean you continue to access health care with your OHIP card, not your credit card. Under Premier Ford, that will never change. We will continue to work with our partners to make it easier, faster, and more convenient for you to connect to care, because your health matters. Thank you again for being with us today. Stay well, and it is now my pleasure to turn it over to Associate Minister Michael Tibollo, who will say a few words and is so critically important in rolling out our Roadmap to Wellness piece. Michael.
Good morning, everyone, and thank you, Minister. Thank you, Karim, as well, and your team here at Ontario Shores for welcoming us today. And thank you, Minister Jones, for including me in this important announcement for the children and youth of our province. I'm proud to be here on Bell Let's Talk Day to announce the expansion of our successful upstream investments in child and youth mental health. We know that over the past 3 years, we've seen an increase in our youth experiencing anxiety, depression, suicidal thoughts, eating disorders, and substance use. Through Ontario's Roadmap to Wellness, we are creating a continuum of care where Ontarians of all ages have access to timely and appropriate mental health and addiction supports. And today's announcement is only going to build on the important progress we've made since launching our comprehensive strategy nearly 3 years ago. I'd be remiss not to mention that actually took place March 3rd, 2020, right here at Ontario Shores. And of course, we all know on the 17th, we had the announcement of the crisis of the pandemic and the state of emergency being declared. So it's been an incredible 3 years, but in the course of that 3 years and since 2020, we've invested $525 million in innovative solutions to improve the quality and access to mental health supports, while at the same time shortening wait times and removing barriers to accessing care. And it's just the beginning of our overall commitment to invest $3.8 billion over 10 years. We're adding capacity to meet demand, filling gaps in the care continuum, and creating a provincial infrastructure to connect community, primary, and acute care to better wrap around the needs of people with mental health and addiction issues. One Stop Talk is just one investment we've made to support the mental health of our children and youth. Since 2020, our government has invested more than $9 million to create 14 youth wellness hubs across the province. And we continue to make progress. Through our Addictions Recovery Fund, I'm pleased to announce we're adding 8 additional youth wellness hubs, bringing the provincial total to 22. In fact, one of these new youth wellness hubs will be located at Sagamok-Anishinaabe First Nation and will offer culturally safe and appropriate primary care, mental health and addiction services to Indigenous youth in and around that community. Ontarians have faced challenges accessing mental health supports for far too long. They want action. With investments like these, we're moving in the right direction and fulfilling our vision for an Ontario where everyone has access to high-quality mental health and addictions treatment and support when and where they need it. Thank you, and I'm now going to pass it back to Minister Jones for the next part of our program.
All right, thank you. We'll now begin to take questions from the media. If media present can just line up behind me here at the scrum mic. As a friendly reminder, it's one question, one follow-up. Please state your name as well as the outlet you're with. Thank you.
Hello, Minister Jones. Toronto's mayor has asked for a national summit on mental health care. He says that when the federal governments and provincial governments don't adequately fund mental health care, the responsibilities are often offloaded to the municipalities, and they don't have the adequate funding to deal with all of the issues that come up. What would you say to that?
Well, there's a couple of things that I think are really important to cover. You know, we have had ongoing and regular conversations with our federal government to actually be a partner in our healthcare funding system. You know, we're only asking for an increase up to 32%. Many people, of course, in the province of Ontario believe the federal and provincial government fund healthcare 50-50. It is not accurate. We want to have that ability to offer more services. Specifically to Meritori's comments, you know, one of the investments that we made very early on as a government was to increase the use of mobile crisis intervention teams. And those teams are matching mental health professionals with a frontline police officer. And the success rate of those COAST teams, mobile crisis intervention teams, have certainly made our community safer. There is no doubt that more work needs to be done, and I am always willing to work with whether it is municipal police forces or municipal governments. We just wrapped up 2 days of conversations with municipal leaders at the Roma conference, and many of the conversations were about how can we leverage the existing systems and infrastructure that we have in community with provincial support. And if the federal government wants to be part of those support systems, I'm here welcoming them with open arms.
Mr. Jones, Fraser Snowden with Global News. My colleague Colin DeMello is wanting to ask a question about the fast-track nursing program. In the recent announcement, they say, you said that we're going to fast-track the registration of internationally educated nurses, yet less than 100 nurses have taken the province up on that offer so far since the policy went in place. Why do you think the uptake has been so low?
Well, in fact, 2022 was a historic year. We had almost 6,000 internationally educated nurses assessed, applications reviewed, and ultimately licensed in the province of Ontario. What Colin is specifically referencing is one program of a multifaceted pathway for internationally educated healthcare professionals. We have worked with the College of Nurses, and frankly, they have really helped in ensuring that people who want to practice in the province of Ontario have that ability to get assessed, reviewed, and ultimately licensed if appropriate. We'll continue to do that work. We, of course, have other programs to ensure that Ontario students who are interested in training to become nurses have an opportunity through the Learn and Stay grant program that will cover their tuition and books, because we know that we need a larger number of people. We have, Minister Dunlop will tell you in colleges and universities that we have had a historic year of individuals who are applying for those nurse programs. Of course, that takes time, which is why we initially focused our immediate needs on internationally educated who are here in Ontario and want to practice, and then, of course, the other pieces that include the Learn and Stay grant program.
Follow? Yeah. Coming from a family of nursing, a lot of criticism I'm hearing is that what are you doing to retain those nurses? A lot of them are being burnt out. My wife, for example, a lot of family members now, they ask why is the province focusing on bringing nurses in when they need to retain the people that are, burning out and getting out of the workforce?
So it's not an either or. Of course, very early in the pandemic, there is no doubt that all of our frontline professionals, including individuals here at Ontario Shores who continue to come to work every single day, our police, our firefighter, our paramedics, and of course our nurses and hospital workers had experienced a much higher stress level as we worked through the pandemic to understand where the risks were and how to assist people, which is why one of the things that we did early on as a government was a $5,000 retention and incentive pay to say we understand that this has been a unusually challenging time in your career pathway, and we want to assist you through that program. So it's not we're focusing and ignoring on one over the other. We're doing many programs to make sure that the individuals who are practicing continue to have that support from their provincial government. And of course, ultimately, Ontario's population is growing. Ontario's population is aging. We also need to actually have more healthcare professionals in the system.
All right, is there any other media with questions at this time? Okay, that concludes our media portion. If I could get everyone at the podium
Thanks
to
for your
stay
time,
there,
everyone.
and all the other dignitaries present to come up for a photo. Thank you.